Good evening, everyone. It's my pleasure to welcome you all to World Human Sciences and Management Conference 2021 and 22. This is Anant Bhan, Executive Director, Center for ADIVASI Research and Development. We are proud to announce that this conference is conducted along with Indian Institute of Management, Sambalpur, Central University of Odisha, Koraput, and Ravenshaw University, Cuttack. I welcome our speaker for today, Professor Anant Bhan, and all participants across the globe watching us through Facebook Live and the YouTube. To listen, Professor Bhan. The broader theme of this conference is agnotological context of agnotological context and disciplinary practices of social sciences and policy frames. On behalf of Center for ADIVASI Research and Development, I extend my profound gratitude to our patrons, Professor Sanjay Kumar Nayak, respected Vice Chancellor, Ravenshaw University, Professor Mahadev Jaiswal, Director, Indian Institute of Management, and Professor Sarath Kumar Palita, Vice Chancellor, Central University of Odisha. The convener of this largest virtual conference, an eminent Indian historian, Professor Chandi Prasad Nanda, an eminent policy activist, writer, and philanthropist, Mr. Charandat Panigrahi. Dear friends, the main outcome of this conference is to come up with the national and international framework for the education system in future, and the crux of this conference will be the use of digital technologies such as artificial intelligence and augmented reality and virtual reality that is being increasingly adopted after the outbreak of COVID pandemic. We hope this conference will help students, faculties, researchers, and all to expand their mental horizon and help the education system to adopt the best in future. Ladies and gentlemen, the Center for ADIVASI Research and Development is a leading research-oriented institution promoting ethnographic, empirical, and evidence-based research for engaging and addressing the challenges that 21st century globe is facing today. The prime agenda of this institution is to come up with potential policy solutions for social change while believing in the idea of debate, dialogue, and discussion, and expertise, experiencing, and education. The institution focuses on marginalized communities and work for their livelihood to protect the nature, culture, language, and identity in particular. Different, the age of modernity has witnessed that change is the only constant phenomena for societal purpose to enhance knowledge. Our information work for them is methodical and avoids paradoxically framework which neglected so many centuries from theory to become practice. Our center believes in the concept of social marketing, which is seriously looking for non-profit marketing and builds new social entrepreneurship for check and balance mechanism to glorify generations to come. Center for ADIVASI Research and Development come to serve with the holistic approach of critical thinking in education to fill the gaps and to plan accordingly for the voiceless communities. Ladies and gentlemen, in today's evening, we have with us Professor Anant Bhan. Professor Bhan works at Sangat. It's a Bhopal hub office. He's a medical graduate with a master's in bioethics from the University of Toronto in Canada. He's a researcher of global health policy of bioethics with over 18 years of experience and numerous publications to his name. Professor Anant Bhan is currently one of the leading voices on issues related to medical ethics and social justice in India. He's also the immediate past president of the International Association of Bioethics, serves as an adjunct professor of Yenepoya University and as an adjunct faculty at KMC Manipal, and is a member of several committees. So welcome Professor Bhan to World Human Sciences and Management Conference. Professor Bhan, your topic as suggested by you is important health policies to save the pandemic world. So without taking much time, I would like to invite Professor Bhan to initiate his talk. Over to you, sir.
Thank you so much. Thank you, Rudra for those very kind comments, and a pleasure and honor to be part of this conference. And I would especially like to thank Bikram. I know Bikram now for many years, and he's been very kind to invite me to similar events before. And I do apologize that we had to reschedule this talk a couple of times, but I'm glad that we have a chance to talk today. So I think the plan today was to talk about some of the issues which are relevant from a pandemic perspective and from my own sort of viewpoint as someone who looks at public health, global health more closely to sort of try to highlight some issues, especially because now hopefully we are in a situation where because of high vaccination rates and because many of us have already been exposed to the infection, that the likelihood of serious spread of disease should be lesser, though we can't completely rule it out. But then what are the lessons that we need to learn and implement based on what we've seen over the last 2 years? So I just wanted to check, Rudra, that you can see my slides so that I can proceed. Can you just
Yes,
confirm?
yes, sir. Please continue.
Okay, great. All right. So the focus then for today is to talk about important health policies to save the pandemic world. And I will try to cover that in maybe 30-40 minutes, and then we can have some discussion. So most of the talks that I do nowadays, I start off by acknowledging the loss of lives that we have had. And unfortunately, this has included many health professionals. And of course, they have been very, very key to our pandemic response. Without their contributions, we could not have been able to face the onslaught of cases that we had. But unfortunately, we've also lost many. These include doctors, nurses, paramedical staff, many other health professionals, and in fact, many of our family members, colleagues, etc. So I think it's important for us to remember all of those losses and try to see what we can learn so that we don't see such a situation again in the future. So the fact that we struggled during the pandemic from a health perspective is not new to all of us. I think all of you would have been well aware of the kind of scenes that we saw, the photos which came through when the second wave hit last year around early summer, and the impact it had on many hospitals where there were no beds available. If beds were there, there was no oxygen available. There were people waiting in ambulances to try to get into a hospital and get a bed, but failing and unfortunately losing many lives. So why is it that we had that kind of a situation? And if you look at it closely, you will realize that one of the problems, of course, is the fact that the Indian health system has very shaky foundations, right? So the chronic underinvestment that we've had in this sector, the neglect that we've had in public health means that the foundations of our public health system are poor or are weak. And hence, whenever you have any kind of a situation which is a crisis like the current pandemic, then it's going to be extremely difficult for the health system to be able to respond. And so that is something to keep in mind that, this was not something which was new to the pandemic, but before the pandemic as well, we were struggling with being able to cope with our health needs with this kind of a health system. Now, of course, part of the challenge also is the fact that the density of health professionals in a country like ours is much lesser than many other high-income countries and middle-income countries, even some low and middle-income countries. And that would mean that the availability of health professionals for our population is a challenge, because unless you have adequate number of health professionals available, you will struggle to provide quality services. So you can already see that as compared to many other major countries, we are not doing so well. Now, of course, you might say, well, these are all rich countries. Why are you comparing us to rich countries? But even if you look at neighbors like Bangladesh and Sri Lanka, in many aspects of health, they do much better than us. So I think we do really need to pull up our socks to ensure that we are able to provide for the health needs of our population. Now, one of the challenges during the pandemic, of course, has been the fact that because there has been so much focus on COVID, everything became about COVID, complete hospitals being converted to COVID hospitals, that the many other diseases of public health importance were probably not given adequate attention because everything was being diverted to COVID. So even in Odisha, where many of you are based, for example, malaria is a major issue, tuberculosis is a major issue, maternal and child health is a major issue, malnutrition is a major issue, routine immunization needs would be major issues, and of course non-communicable diseases would be a major issue. But all of them, data is starting to show, have actually suffered negatively because everything was about COVID for many months, right? So the number of additional cases which would have happened because the program was not functioning well, for example, the TB program or the malaria program, is something to look at, and also unfortunately some deaths that we will see in these programs or in these disease areas because of that same reason. Now, there are many people who've tried to analyze this, right? Because at the heart of it, from a social science perspective, we need to try to understand what does it tell us? What can we learn from this, as we were talking about? So the pandemic, of course, reveals to us that this is a tale of neglect. There has been a historic neglect of public health. It doesn't matter which government, doesn't matter which party, it doesn't matter whether you're looking at central government or state government. There's been a systemic undervaluation of the importance of public health. And this is also the case that in a nation like ours, the fact that some of the responses were more states specific rather than involving cooperation across states was also problematic. For example, you saw a whole migration which happened around the first wave, a lot of people going across state lines and not being recognized or being treated unfairly, and that tells us something about the need for us to also look at how do we provide health services in a way that state borders should not matter. So there is some mobility of access to healthcare. And this also was reflected in the many other issues that we saw, the way tests were available or not available, medication being available or not available, black marketing, etc. And a lot of additional pressure which was there on frontline health workers like ASHAs and ANMs, and yet not providing them adequate resources. So they were not sometimes having access to PPE, personal protective equipment, gloves, masks. They were not given incentives in time, but they were being expected to participate in the response. Now, one of the facets of our national response, of course, was a lockdown, as you would all remember. So India was among the first countries to go into a lockdown, and this was among the most stringent lockdowns in the world at that point of time. Now, just from a public health perspective, it's important to remember why we go in for lockdowns, right? So lockdown is a public health intervention where the idea is that it would serve as a mitigation exercise. It would serve as an exercise to help the infection from spreading too fast. And how would it do it? It does it by actually inviting people or requesting people or sometimes mandating people to stay at home, right? You stay at home, so you decrease the chances that people will meet with each other. So you can ensure physical distancing. It reduces social interactions. It allows hence time for your public health services like testing, for additional beds, etc., to be arranged. So in a way, what you're trying to do is slow down the spread of infection. It also helps you localize the spread of infection, because if people are going to stay at home and if they are infected, hopefully they will not be spreading that infection beyond their home or localities, because if they're traveling around, of course, you cannot promise that, right? And it hence allows for us to try to see that wherever there are clusters of infections, you can try to respond to that. But of course, the downside to any stringent lockdown in a country like us, which has a lot of informal workforce, is because of the impact on such a large population that we saw. As I said, the Indian lockdown was probably the largest globally because it was a national lockdown, but it also made lives extremely difficult for those who were socioeconomically deprived. Because many of you would remember these visuals that we saw, large-scale migration happening. Unfortunately, some families dying on train tracks. Them being sprayed by bleach on state borders. So in a way, not being treated very nicely, and being also sometimes treated inhumanely. Without adequate preparation, we had implemented a lockdown without actually thinking through the ramifications of these kinds of large scale human movements. So that is something to think about, that if we ever do need to go in for such large steps, then what is it that we need to do to preempt, to prepare for such kind of circumstances? Now, of course, the lockdown also had an impact on nutritional availability, on the availability of PDS, etc., which impacts many families. And there was hence a lot of collateral damage which happened, including availability of care. If you had hospitals which were shut down, hospitals which were converted to COVID care hospitals, then where would someone with cancer care requirements go? Where would someone with dialysis requirements go? And even if they were able to identify a hospital where they could go to, but there was no public transport available. There were very few ambulances available. The ambulances which were available were overcharging, right? So this was the kind of impact which it had on families who were trying to access care. And many elective procedures ended up getting cancelled. Vaccination for non-COVID diseases, the other vaccine preventable diseases, also probably had a downside. And this is something that, again, we need to think about. Now, if you start looking at data, Gaon Connection, which is a rural media outlet, some of you would have read their stories, had done a survey in parts of rural India. And this was in 2020, I think, where they went around and tried to find out what was the impact of the lockdown. So their data indicated that in the areas that they did the survey, that almost 42% of pregnant women in those areas had not undergone their prenatal, that is antenatal checkups, vaccination. That almost 40% of households with pregnant women in green zone districts, so the green zone districts were districts where the cases were relatively lower, the lowest among all of the districts, right? Even there, they did not undergo pre-delivery checkups and vaccination. That only around 55% of households with kids had reported, had reported vaccination of kids, almost 45% gap. And this tells us that, you know, there was, of course, some downsides and impacts on routine health services. Now, later on, post-lockdown, one of the issues also was that that non-COVID care suffered, and the care for these conditions continued to lag in both private and public hospitals even after the lockdown was removed. And there were many patients who had not accessed care because they were afraid they could not reach hospitals in time during the lockdown. So they came after the lockdown, but by that time their disease condition was very complex, sometimes with multi-comorbidities and making it difficult to treat. The other important impact which we also need to recognize and talk about is the impact on women's health, right? So there's enough data that globally COVID-19 has had a devastating effect on women and girls, right? And this is recognized by the UN Population Fund. This is recognized by many other international organizations. And even in India, there is already data that women could not access routine health services, reproductive health services, abortion care, etc. And this, of course, would have had an adverse impact on their health. So disruption of health services especially puts women and girls at risk of decreased access because pre and postnatal health care might not be available. Family planning, contraceptive supply might be impacted. Women who are at home and their partners are also at home might be at higher risk of sexual violence, intimate partner violence, domestic violence, and layered on top with the disruption of health services that, of course, could impact them negatively. And hence, whenever we start looking at data, as social scientists also, it's important for us to learn to put to look at gender disaggregated data, to start applying a gender lens to try to understand the impact of the pandemic for women and other genders, yeah, including transgender populations, etc. Now, if you look at the impact on the frontline health workers, that's another area which needs some attention because, as I discussed earlier, they were also struggling with a whole lot of new expectations while they were not necessarily being compensated or protected adequately. And in fact, those ASHA workers who were protesting for their rights during the pandemic period had FIRs filed against them, right? So our frontline workers who were really responding to the needs of the populations and communities were actually being hence criminalized in a way by FIRs being filed rather than their their genuine grievances being heard, and that is of course also something which is worrisome. So this is another lesson I think for all of us, that women's health has to be a priority, especially when you can anticipate there will be a whole lot of disruption to health services, and especially for those of you who are researchers and women researchers, you would also recognize that in STEM disciplines and social science, etc., that there was a negative career cost of COVID-19 for female researchers, as they had to stay at home, manage often work from home, manage their home responsibilities, and find it extremely difficult to be able to cope up often at times, right? So that is important to recognize. The other important issue, and as was being mentioned initially, I also do a lot of work on mental health now with Sangat, is the need to recognize and acknowledge the impact of the pandemic vis-a-vis stigma in mental health. So again, the government, I think, did recognize that mental health is a need, but they did also talk about the fact that stigma is something to worry about, and initially the stigma was really high. Anyone who would sneeze, anyone who would cough, people would start looking at them as if they were, they were having some kind of a problem, and stigmatizing them. Whole houses being labeled, with if there was a case which in that house which had tested positive, then big notices being put, barricades being put before the house, and so a whole lot of stigmatization happening without really adequately understanding what ramifications, what impact it would have on those households. Sometimes lists of households being shared on social media, on WhatsApp. You could see an Excel sheet with a list of people who had tested positive for that day, and that, of course, was problematic. And this the kind of stuff that we should have? Perhaps not. Maybe we should be looking at it differently. Of course, unfortunately, there was to some extent data indicating that there was a spike in suicides as well, including in young children. And that is something I think we really need to analyze more and try to find out if that is indeed the case, and if yes, what might have been some of the triggers. Now, I also do a lot of research, and I'm also someone who looks at research a lot as someone in the ethics field, and that is another area I think where there is a need to look at some of the policies. One of the, of course, big pluses of or scientific wins was the fact that large randomized control trials to tell us whether medicines work or not, whether vaccines work or not, were done in relatively a very, very short period of time, right? Usually, RCTs for vaccines take years and years, but here you had vaccine trials which are done in literally thousands of patients, and sometimes in multiple countries across multiple sites, managing to give us data on safety, on efficacy, and leading to vaccines being available very soon. So that is something, of course, which we should be all very proud of. And this includes work done in India, of course, with our own vaccines and studies which are done in India. But at the same time, there was a lot of poor quality research which was also happening. So uh, the quality of evidence which would come from these kinds of studies was questionable. There was a lot of online surveys. I'm sure all of you would have gotten links to surveys to do on WhatsApp, on your email, etc. Whether consent was being considered in these kinds of studies, whether ethics review was there or not, whether there was adequate attention to privacy confidentiality requirements, possible risks of these kinds of studies. Not very clear, and that is something to worry about. One of the challenges, of course, is the fact that our regulatory system was not really prepared for this kind of a mechanism. And so the decisions that they took when you add on a deficient health system and leaky infrastructure became a little bit problematic, because the way they decided to go in for regulatory approvals, etc., sometimes left a lot to be desired. And so specifically around vaccines, if we look at it, now if you look at how the various phases of vaccine development happen, as you would see on top, the traditional paradigm for vaccine development is many, many years. But as I was saying earlier, during the pandemic, this was literally collapsed down to almost under a year. And so that brings its own challenges. Even if you do that, what's important, as was pointed out in the science paper, is that it cannot be at the cost of good quality science. It cannot be at the cost of ethical and regulatory requirements. So even if it is the pandemic, the need to reinforce importance of the work that you're doing, rigorous design of the work that you're doing, analytical integrity, trials should be completely reported promptly and consistently with pre-specified analysis in your protocol, as well as only do science which is feasible. All of these kinds of principles should have been applied totally, but we saw a lot of gaps in that, right? So this includes the fact that, for example, clinical trials which might not yet have reached their endpoints, even before they reach their endpoint, seemingly approvals were given, right? And sometimes it might be the case that there was data, but if you don't communicate that transparently to the wider public, the assumption would be, is there data? Is there not data? We don't know. And so these kinds of seemingly decisions being made with no clear rationale provided and with some opacity is something which was not very helpful. And at the same time, you had almost a politicization of the pandemic response. And as was mentioned in the British Medical Journal, there were these concerns that science was being suppressed for political and financial gain. And again, this is not unique to our country. This was potentially happening in many other countries. And you can layer in issues around corruption and politicians and industry being involved, and what that would mean. Now, specifically for vaccines also, as you would remember, there was this whole issue of some states announcing even way before vaccines were widely available, that if we, parties saying that if we win the election, we will make the vaccine available to everyone in the state for free, when there was limited number of vaccines available for the whole country. So how was someone able to politicize vaccine availability without actually talking about what would be the prioritization exercise, which populations would be priority populations, how would they be chosen, what was the rationale, etc. So this whole issue of vaccine politicization, populism, nationalism, and subnationalism became problematic. And if you look at it from a global perspective, of course, this is also a challenge, because now you have many high-income countries which have managed to finish vaccinating most of their eligible population. They have in fact now almost finished in some cases with booster doses as well. While you look at some other countries, especially in other parts of the world, which are low and middle income countries, where the coverage remains extremely low relative to the rich countries. Now that's a problem, because if you are not able to get vaccines to go across to countries in Africa, countries in Asia, which require these vaccines, then you will have a situation where we cannot ever truly perhaps be able to fast enough get the pandemic to end. Because if there are people who are unprotected in one part of the world, then there is always the chance of disease resurgence, more variants coming, which might be more virulent, right? More infectious, etc. So that is something which will worry us. For those who are interested, some of these issues were also talked about from both the science, ethics, regulatory perspective in this white paper, which was written up for the Indian National Science Academy. The editor is Professor Narendra K. Mehra, and I was one of the authors, and I wrote specifically around ethics and regulatory issues. So this is available from the INSA website, and if some of you are interested, you can certainly look at that. Now, one of the sort of issues which is often raised is, why is it that not enough people were sometimes taking the vaccine when vaccine was available? Was there vaccine hesitancy, right? Because there were sometimes these kinds of letters which were being written up by doctors, by resident doctors, saying that we don't want to take X kind of a vaccine, we only want Y kind of a vaccine. And so people were asking, well, does that mean that there is some kind of hesitancy against vaccines? And similarly, there were a lot of people who said, well, people in rural India, why are they not taking the vaccine? Even if people are going there, refusing to take the vaccine, why is the vaccine coverage low in XYZ location? Now, as we try to analyze in this piece in the Hindu, you have to really understand the need to dig down a little bit deeper rather than labeling everything as vaccine hesitancy. And this is where I think, again, social science perspective can be very important, to try to understand the history of public health in rural India, the history of health system availability in rural India, the history of outreach services for adult population in rural India, and then say that when you bring in a new program, it suddenly is doing the kind of touch points individually that you have never had in the system, then perhaps people will be skeptical. People will ask, well, you've never come to my house before. Why is it suddenly that only for COVID-19 vaccination you're coming to my house and requesting me to get vaccinated? Where were you all the time when I had a whole lot of other health conditions, right? That's a legitimate question for them to ask and think about. And so maybe we want to visualize concerns around the vaccines or a reluctance to take the vaccine in a little bit of a different way rather than just labeling it so. The other thing is, when you have scarce resources like vaccines or drugs, then what kind of principles should be applicable for fair allocation? Because it should not be the case, especially so in a pandemic period, that the availability depends on your ability to pay. So if you're a rich person, you have access to a drug which is useful. If you're a rich person, you can go and buy the vaccine and get it administered, or you have a choice of vaccines. Whereas someone who might not have financial resources struggles for everything, right? So what are the kind of principles which should be there for fair allocation? So of course, transparency, the need to be inclusive. So any population which is impacted, their perspective should be listened to, that there should be a certain consistency in the way you apply the principles, and that there should be also accountability built in. so that people who take those decisions can be held accountable for those decisions as well. Now, if you look at, again, a global perspective, it's important, again, that so far, the response globally has largely been driven by a charity-based approach. Oh, we will donate whatever, 1 million doses, we will donate 2 million doses, we will donate 1 lakh doses to X country, Y country, or to WHO or to COVAX. That is not the way that we can visualize ending the pandemic, right? We really have to think about it from a justice perspective, where charity is not enough. It's about equity from a global health perspective and ensuring that countries which have low availability of vaccines are now supported to get more vaccines. Because only when everyone is protected can we actually truly say that we might be on the way to the end of the pandemic. Now, I think I've taken a fair bit of sort of analysis around what were the problems. So I'll try maybe now in this section briefly to talk about some proposed solutions from a policy perspective, from a recommendations perspective. So if you look at, again, the experience globally, you'll recognize that not just in India, but many other parts of the world, there have been concerns around a fragmented health system, that the countries, how they are responding was always dependent on how strong or resilient their health systems were and how much they were able to quickly respond to the kind of emerging requirements during the pandemic and waves, etc. And this is where I think many analyses have been done. WHO came out with this guidance document on maintaining essential health services. There was this paper on policy and planning where they again talked about pandemic preparedness from a global health security lens, more stable funding requirement, financing requirements, and the need to make sure that research was responsive, research was supported, etc. So we have to think through whether all of these were actually the case in India. And also, all of these consulting organizations, like in this case, McKinsey, also recognize that health is an important investment and suggested that the cost to the world's economy, if we did not invest in health and if we did not make our health systems resilient, would be a lot, right? And their estimates or calculations were clearly indicating so. So what did they recommend then in this kind of a working paper? They talked about the fact that health needs to be a key part of economic growth discussions. But even if you look at our own national budget, health was mentioned, but not adequately, I would think. And there was some mention of mental health, but not a whole lot of radical difference in the way health is funded. And this is a bit surprising because we are still in a pandemic. And again, the McKinsey report talks about investing in health to build greater resilience, promoting social and economic equity by improving the health and building on innovation momentum sparked off by the COVID-19 crisis to make it perhaps more stable and long-lasting. So again, hence, it goes back to this issue of health system resilience, which is defined as the capacity of health actors, institutions, and populations to prepare and respond to crisis while maintaining their core functions. And for this, we of course need to learn well from models which worked during the pandemic, including our own micro experiences within states or districts, good examples, good case studies. Look at the fact that there is underfunded healthcare in India, and also recognize that out-of-pocket expenditure in India is another issue which needs to be given adequate attention to. So hence, that is where we did some writing during the pandemic. This was one of our pieces which came in the print, and we talked about the fact that politicians were very happy to announce about, I'm going to inaugurate 1,000 beds tomorrow. I will inaugurate 5 hospitals day after. I will purchase 1,000 ventilators, etc. Or our state has been made the order. Of course, this is important. Infrastructure is important, but equally, or I would even argue more important, is human resources, because you can have all the machines you want, but unless you have people who can run those machines, how are you going to really use those machines to work? If you did not have enough boots on the ground to do contact tracing, then how are you going to be able to test, trace, isolate, which was an important strategy during the pandemic, right? So in the absence of enough number of people being available, this was always going to be difficult. And another way of putting it in a follow-up piece was our argument that it was very clear after a few weeks of being in the pandemic phase that COVID-19 was not a T20 match. So our approach, even from a policy perspective, should not have been about a small time set of events, but thinking through from a longer perspective, like almost like a test match. How are we going to cope up with the requirements which are coming through from a longer perspective? So we should have thought of the COVID-19 response as a test match, but unfortunately it was treated as a T20 match, right? So in the future, then what do we need to do differently? One of the things, of course, is that we need to have more investment in health, ensure that health becomes a political issue. So in elections, people should be talking about health as an important campaign area. But unfortunately, in ongoing elections and recent elections, that has not been the case. It's again going back to issues which are more divisive in nature, which don't really focus on the needs of populations, etc. Some of our legal acts, such as the Epidemic Diseases Act, is a colonial act. It's now outdated. It needs to be updated. Our own evolving health needs need to be responded to. Partnerships with civil society organizations like CARD, for example, institutions, academic research, private sector, etc., needs to be thought through, but with good quality governance mechanisms so that there is accountability and transparently built in. And again, as I said, we need more trained human resources, we need governance mechanisms, we need surveillance for disease outbreaks. Unfortunately, just as an example, what you also see during the pandemic, rather than planning for the longer term by hiring more staff members who are permanent staff, you had this short-term, hiring happening. For example, there were staff nurses who were being hired for 273 rupees a day. Now, nurses are highly trained health professionals, right? And if you're hiring them at 273 rupees, which is, I think, probably less than the minimum wage in many states of India, then that tells us something about how we are responding to the pandemic, that we are not respecting our health professionals enough. The fact that epidemiologists who are trained with a master's degree, many of them have an undergraduate medical degree, and then go on to do their master's in epidemiology or an MPH, were only being offered 25,000, tells us that, what are you going to expect? Who are the kind of people who will apply? Probably not people who've been trained, who are trained because they will go on for a job which pays them better, given their specialization. So that is something to think about as well. So clearly, our health system is fragmented. There is a requirement for a coordinated and coherent response. There were some ideas around potentially looking at a national crisis management committee, which can be set up in situations of natural calamities, could have been leveraged where there was some cross silo collaboration and work towards pandemic response, and maybe that could have helped better. So in summary, what COVID-19 is a form of a human tragedy. But this human tragedy is also an opportunity for us to pass what kind of society we aspire for as citizens of this country, as researchers, as social scientists, and as members of civil society, as students, as academics, as faculty members. And if we aspire for a certain kind of a society, then what are we going to do collectively to ensure that we are moving towards that target or that goal? That, I think, is the most important thing for us to think about. And whatever is needed for that, I think we should start putting into action now, implementing, etc. And for that, I think we need to work with our policymakers, with our politicians, and ensure that they are accountable for all of that. Thank you so much for your attention, and I hope I raised some relevant points for discussion. It was a pleasure to speak to you, and I look forward to the discussion. Back to you, Ruth.
Thank you so much, Professor Bhan, for the exquisite deliverance on the same topic. Now, I'd like to invite Dr. Shravan back to go for a quick comment. Professor Bhan's talk.
Thank you so much, Rudraji, and really let me to take this opportunity to express deep sense of gratitude to Dr. Bhan. Dr. Bhan, you have really unfolded a couple of unseen dimensions of the ongoing pandemic, and you have raised certain pertinent questions as well to the entire galaxy of participants to think and reflect at not only at the individual level but also uh, to discharge their function as a citizen, as a concerned citizen. And your statistics were very good and quite sparkling at some point of time, particularly when we talk about the financing part as far as the health sector is concerned, and few other policy level matters as well. It was really very heart touching and quite eye opening as well, from policy perspective as well, and for practitioner also. uh, what I would say particularly, to be very specific, I have three questions. In fact, 3 points, rather than saying it question. As we all know that right now we are still in that pandemic situation where people are still, not they have not come out of that state of mind where there is terror and horror. So my point is, from a global perspective, I mean, still there are doubt, and as a common citizen we are still to get an answer of the root cause, the origin point, and few very basic questions of this pandemic, like how did it started, was that, is it you know planned strategy to sabotage the entire the gamut of political affairs that we are talking about? And if so, why the international agencies are silent? Because we all have witnessed what has happened over the last couple of years, particularly the investigating agency and few other reports that have not clearly specified this all bottlenecks and issues related to the origin of this pandemic state of affairs. Number one. Number two, when we look at the statistics, now you see, most of the cases that were identified and led to death, it was more of in urban or in in metro cities. Now we do not have actual as such specific and reliable data that could differentiate the death rate and few other parameters where we can distinguish how this pandemic has affected the life of rural people, to be very precise, when we talk about the tribal people, because more or less we all could see that there is a difference in terms of the death rate and infection rate with the people who are living in metros, in cities and other areas, whereas rural people to a large extent, although they have been affected, but the death rate I do not think is higher in comparison to the people living in those areas. If so, what is the reason? Or if not, I mean, what has been the reason? Either or way. And the third one is that, particularly when I talk about the case in India, recently we all have seen the budget session, and we have, in fact, we were in the top 3 countries across the world who have suffered badly in this pandemic. But still now, we have not been able to increase our budgetary provisions, our GDP, particularly, share in GDP, to, allocate adequate amount of financial support to the health sector. So what is the real cause or the story behind this all thing? Because we all could see that, as you have rightly given a picture, where these people have certified themselves, like they have they have given prize or medals to themselves before completing the real target. So is there a nexus between the private affair people and the people sitting in government in public places? Or what has been the cause why we are not being able to address that financial allocation, particularly to the health sector? We all know that this was a complete collapse of our health system, and we have not been able to address even in the recent budget. So if you could give your couple of reflection on this, probably the audience will be in a better position to take it further. And yes, you have talked about tracing, testing and everything. Now my point is that, is it the only way to to combat this pandemic situation? Because what I could see is that it is more like the casual approach and the lack of awareness among people, because now when we look about the Omicron and other virus thing, so it is again some sort of callousness that we are taking it. Is it the fact, or I mean, what is the underlying story behind this? So probably these ideas or your reflection on those particular points, I think, can help us a lot to take the discourse further. And once again, thank you so much for giving us this insight and sharing your valuable ideas and opinion as well. Over to Rudraji.
Thank you so much, sir.
So please, do you have any comment on Professor Bag's opinion?
Sure, yes, so I think those were some very good comments. Thank you, Professor Bag. In terms of the origin, I think, this has now been an issue, I think, which a lot of people have raised questions about. There, of course, are varying perspectives on this. Was this man-made? Was this really, something which jumped from wildlife to humans and then spread through? Did China do, for example, enough initially? Was that information transparently available? What has been the role of WHO? Why is there not an international committee or investigation group which is looking at this? And all of those are legitimate questions, because I think fundamentally, if there are concerns about this kind of a global health threat, which now has enveloped the world for well over 2 years, then it's fair that there should be a transparent mechanism of trying to find out. Now, some of that will require science as well. For example, good quality genomics work, trying to trace back the original few cases and seeing what kind of footprint the virus from which can be isolated from those cases tells us, etc. But will also require us to have more transparency and an agency like WHO playing a more proactive role, because these are issues which cross national boundaries, and of course, some countries will not be so much willing to share information sometimes. But if we can work as a global collaboratory of some kind, or collaborate, from a collaborative perspective, perhaps there can be a way of trying to find out. So in the absence of that, I think all of us will have our own take on what potentially could be at heart. Your point around why is it that we are not still investing in health enough is exactly on, it's on point. I think that's a question all of us should be asking, and this should be asked at all levels of government. Of course, it is not just about the union budget. It's also about the state budgets, which will be coming around now for most of the states. It should be about local self-government as well. It should be about municipal corporation elections as well. Because health is a state subject. Health is also, there is so much which the national government can do. But what are the allocations like? How is money being spent? Why is it that sometimes creatively spending under water and sanitation is clubbed with health to try to show that we are actually spending a lot of money on health? But when you really try to dig it down, dissect it out, you will realize that perhaps the kind of additional investment which is being cleared whenever you are trying to do allocations year on year. So that is certainly not happening. Whether there are conflicts of interest, whether there are private sector interests which are influencing policymakers, one doesn't know. But one would have thought that, especially after 2 years of a pandemic, that there would have been a recognition in policy circles that it is extremely important for us to continue to invest in social sector, and that includes, of course, education and health. And it's important, as you also rightly pointed out, for us to ensure that our politicians are held accountable for that in elections, after elections. And if we don't do it, then it's also a failure at our end, right? So this goes back to what is our role. We have rights, but what are our duties? And our duties include civic duties to ask these kinds of questions and not let policymakers and politicians go scot-free on this important question. To your other question around rural India versus urban India, yes, but this might also be a function of data. And I think, as you would have seen, and most of us have seen, there is a lot of dispute around, do we really have true case data on the case count? The official numbers of cases and deaths versus what has actually happened are we sure that there is not a huge difference between the two? And that is something for all of us to think about, that, even if we look at it anecdotally in our own circles, what the government might claim about cases and deaths versus what we know, and especially so in Omicron, how many people with symptoms of infection actually got tested. If you just look at your own networks, you would realize that there were many, many people probably with symptoms, whole families who just did not get tested. And so the official numbers of the number of cases versus what might be the true burden is probably a fairly, there's a huge, fair bit of difference between the two, and that tells us something. But it's also the case that, data is available often from urban India because there are private sector institutions, public sector institutions. It's easy to collect that data. But if we don't have systems, and this goes back to the leaky health system that we have, that data which is coming through from rural India, one, are we getting the right data? Is it data which is true in nature, or has there been some kind of tinkering with that data? And how much data are we missing is the question we should all be asking. So hopefully, as I said, if we can keep all of these in mind, then in the way we we have a vision for what needs to be done differently post-pandemic, all of these things will be addressed. But thank you. I really enjoyed your questions.
Thank you so much.
Thank you.
It's
Dr.
really
Jain,
very, yes, please, Rudo, any queries from anyone?
No, I'm inviting you.
Okay, thank you. Thank you so much, sir, for your very enlightening and very wonderful deliberation. It's really pleasure when we should always listening one of the most important voice of Global South in many ways related to public health and policies, and one of the pioneering voice of social justice in terms of representing so many times in WHO from in our countryside and South Asia as well. Sir, as you rightly mentioned about public health policies and the history of public health, why not the historians? Rightly, in many academicians, as we can say, or I will put the word for them as experts, quote unquote. Why not any test criticism related to the Spanish virus is concerned? That was perhaps continued for more than 11 years, from 1918 to 1930. In particular, the Manchuria crisis happened in the first recession ever registered in the global politics. Then, sir, what is your ideas to overcome such a very vibrancy panic pandemic world in today's life world is concerned? And what is your perhaps next suggestions for the human generation, and particular the human planetarian perspective, the age of pandemic? If suddenly a new kind of these symptoms will arise as soon as possible through the human world, what kind of suggestion you have made to them to overcome this sustainable policy, and in terms of health as well, sir?
Thank you, Vikram. Those are good questions. So, one, I think the role of historians, absolutely, that they play a very important role. In fact, if we don't learn from our history, then we are bound to repeat the mistakes of the past. And that is often the case because sometimes we don't really have a good compilation, a good analysis of what went wrong in the past to try to learn from it. We sometimes don't have a good distillation of best practices also, including from parts of our own country. Or from South Asia or from other LMICs. If we had that available, perhaps we could learn from it and do better responses. In terms of what needs to be done differently from a sustainability perspective, there are now initiatives such as Planetary Health, which tries to recognize that there is a certain interconnectedness in our lives, that we need to recognize that there is human impact on ecological spaces, that there is climate change happening, that with the disruption of forest cover, etc., more man-animal interactions, wildlife disruption, that we are going to have situations where these kinds of pandemics could always arise because viruses could jump species, as we've seen happen in the past recent years. That situation is always going to be a risk. So if we don't take climate change, the ecological risks, etc., seriously, then we are bound to see more and more of that happening. So if we want to see humankind sustained for many years, many decades, for the next generations, safely preserved, and that time for action is of course also now. So while it's important to, of course, keep accountability in mind, because sometimes it's the case that high income countries, the global north, expects a lot of action in the global south, say on climate change and pollution, etc., industrialization. They don't do enough as well. But so we of course should keep that in mind and make them accountable. But yet also recognize that countries like ours also have a role to play, and we need to plan for the future. So how do we address the crisis which is going to be there on fossil fuels as they start to get more and more difficult to find? How are we responding to that? How are we leveraging the strengths that we have in terms of, for example, the possibility of working with renewable energy, solar energy, etc.? How do we build our systems so that we have better mechanisms to try to avoid man-animal conflict? That we look at conserving our resources, we look at ensuring that there is better surveillance, that there are enough labs available which are quickly able to pick up if there are any outbreaks, or there is a collection of cases happening in any part of the country or part of the region. Then I think we might be able to better respond. But the issue here is much larger than just one discipline such as health. This deals with multiple other areas of governance which needs to be looked at. So I think that's part of what we need to think about, that it's not just about preparing for 1 year or 2 years or even 5 years. We have to really think through for the next decade, for the next 20, 30, 40, 50, 100 years and beyond. How do we respond to the kind of challenges we are seeing from a social, from an economic, from ecological, from a planetary perspective, and try to respond to that. Thank you.
Thank you, sir. Thank you so much. Sir, in many ways, in particular, our country not even taking seriously the public health concerns related to social science when we are going to deal with research. In particular, the time of pandemic happened, many people are asking what happened and what to do. Particular the scientists and the public health experts, they even denied what kind of role they have to play. Much more even these particular bureaucrats and these great luminaries of this country, they will come forward and they will becoming the public health experts. That is a very miscalculate and misappropriation of mislead of information. That is called fluctuate data. And what is your suggestions for the upcoming youngsters? How to deal with the activism kind of research in academia? And what is your more vibrant suggestion for Indian academia as well?
Yeah, so I think, for those of us who are into academics or research in contexts such as ours in LMICs, we can truly never only be purely scientists or pure academics. We have to recognize the importance of context. We have to recognize the role of our disciplines in bringing about social change and working on issues such as equity and justice. And for that, whatever needs to be done needs to be also part of our way of addressing it, in the way we teach, in the way we mentor students, in the way we encourage them to do meaningful research. So the theses which happen, the research which happens, the kind of work that they do should factor in all of that, because it's not enough to just be doing esoteric work which is not going to relate to the real issues on the ground. So I think from that perspective, all of us have an important role to play to bring about that kind of a change. But also importantly, it's not just enough to do research, or it's not just enough to do policy, analysis. What do we do after that? How do we bring about change? Because there are good people in governance, there are good policymakers, there are receptive policymakers. So we also have a role to play, that beyond the criticism, we need to reach out to them and try to work with them to bring about change. And that is the only way things will really be better on the ground, is when we start seeing that change. We'll have all the critiques that we want, but beyond critiques and nice papers and discussions like we are having now, what does actually change on the ground for someone who might be a tribal in a remote part of Odisha? If we can keep that in mind, that how does our work and our mission as people in our disciplines, how can we make lives better for everyone, and what can we do towards that? then perhaps that will bring a certain lens in the way we approach our work and in the way we approach our activism. And activism needs to stop being seen as some kind of a problematic approach, because sometimes activists are labeled in various ways by politicians. Activists are looked down upon. Activism is an important part of any vibrant democracy, and all of us can be activists, even if we are academics, researchers, policymakers, students. In fact, by doing so, I think we might be actually doing a better service to our disciplines and to our nation, to our region, etc., by helping make the world a better place to live in. Thank you.
Thank you, sir. Thank you so much for your very understandable and very ground to bottom kind of answers. Without wasting much of your time, sir, very warm welcome to Odisha. When the pandemic is over, you must definitely come to Ravenshaw as well and Central University of Odisha and IM for more engaging lectures of yours. And now I would like to invite Ruduna and Das to go for a formal vote of thanks. And thank you so much, sir, once again. And looking forward for future engagement also, sir. Thank you so much, sir.
Thank you, Vikram.
Thank you so much, Dr. Zena. Thank you so much, Professor Bhan, for a very engaging session of your in World Human Sciences and Management Conference. You were talking about different aspects of health-related issues in India and how the pandemic is just crossed all the health-related issues in our nation. Definitely, your lecture will be help all the students for their academic research, and they are very much interested to listen you, as you said before that your lecture is cancelled 2 times before. So thank you. With your very busy schedule, you provide us time to discuss over several burning issues of to thank everyone to help me putting this conference together. And first of all, my big thanks to Professor Bhan for your contributions and time. I have to acknowledge our institutional contribution here, in particular Indian Institute of Management, Sambalpur, Central University of Odisha, and Ravenshaw University. My special thanks to our patron, Professor Sanjay Naik, Professor Sarath Kumar Palita, Professor Mahadev Joyswal, and convener Professor Chandi Prasad Nanda and Charudar Panigrahi for their contributions and motivation to organize this intellectual gathering. My special mentions to Dr. Vikram Kesari Jena, Director, Center for Adivasi Research and Development, for putting forward all the sessions very curiously. And definitely the entire team of Center for Adivasi Research. Anupur Patnaik, Professor Prithiri Sriranjan, Dr. Salima, Dr. Mohanty, Dr. Neha Sharma, Dr. Shravan Bag, Dr. Nina Das, and San Kashyap for your contributions to put forward World Human Sciences and Management Conference. Thank you so much. The session is concluded now.
Thank you.